Healthcare is costing our country over 17% of our gross national product, yet many of our healthcare indicators continue to decline. Moreover, health disparities is associated with annual economic losses estimated over $240 billion. Welcome, I'm Jean Drummond, President of Healthcare Dynamics International, and thank you for watching this video entitled Multicultural Perspectives to Advance Value-Based Care for All. This video was designed to share perspectives from a diverse group of clinicians from across the country serving their respective communities. As we move forward from fee-for-service to value-based care and payment, they share their passion for quality care and highlight the challenges to transition in light of their unique patients, practice, and cultural characteristics. When we think about clinicians, whether serving in rural or urban communities, serving these vulnerable populations, it is important that we understand the unique clinical transformation journey for these practices serving multicultural communities.
Value-based care represents one of the most profound changes in how American medicine is getting compensated. And in my practice, which includes care in a large integrated national system, as well as in a small practice at a community health center, we're seeing how this new equation of how value divided by cost equals quality. And it's radically shifting how we think about how care is rendered. We're moving from a fee-for-service system that rewarded quantity to a system that really rewards quality. The systems that we have in place for value-based payment, there are structures that are evolving. They're not perfect, but they are kind of the trend of the future in terms of how we think about the best care that we can provide for not just individual patients, but for populations and communities in general.
Value-based care means many things, but as we're looking at value-based care today, it is the impact on the quality of care, the services that are being provided, training for our staff. It's an impact on those patients that have social determinants of healthcare. So it's more than just the clinical practice. It is the services that are provided within the context of where those patients live, work, play, and entertain.
Well, value-based care for my practice means a bit more work in the area of getting data. Documentation has always been important in a doctor's practice, but even more so now with value-based medicine, you have to document the things that are needed for a patient's preventive health, and you need to be able to have that data transportable to the insurer. So it's a bit more work, and definitely your staff needs to be able to support you in getting that data.
Value-based care means that we pay attention to the quality of the care delivered from a doctor or provider to the patient. And that can mean anything from reaching your goals or getting close to your goals. But I think what's most important that it really entails a partnership between the provider and the patient.
From a multicultural perspective, value-based care has really very profound changes and differences relative to mainstream populations. I care for a largely Asian American population, many immigrants, and how we think about quality to a population that has various barriers in terms of their ability to speak English, their immigration status, their familiarity with different health terms. It represents a big challenge in terms of how we think about quality in that kind of setting. So we are faced with certain challenges with regards to how we get rewarded for the care that we're rendering, and how the difficulties and barriers and the challenges, as well as the rewards of caring for this very diverse Asian immigrant population, Pacific Islander population, gets factored into how value-based payment is provided.
When you talk about a multicultural population, and that perspective for where the patients are, it's a very different approach, because things that are common for the general population may not have applicability for an African American population or an Asian population or a Hispanic Latino population. So again, you're talking about the quality of care no matter what culture they come from. But again, you have to be able to commit to serving those patients in the community where they come from. So taking into consideration immigration status, access to resources, as well as their cultural beliefs, knowledge, and behaviors.
Well, from a multicultural perspective, just as in other areas of medicine, the socioeconomic status of the patient really can impact how they get care and the quality of care that they get. So, for example, if a patient doesn't understand the importance of doing certain tests, it's not something that they've understood from other members of their family or from other people, it could actually reduce their ability to get the care that they need. And in turn, that can impact the kinds of data that we are getting from those patients. So when you're being graded, if you will, by an insurer, based on whether or not your patient is getting certain things done, but the patient doesn't cooperate or doesn't understand how to cooperate, it can actually have a negative impact on your score, if you will, as you're being scored by your insurer. So again, in the way that patients are able to afford the care that they need. For example, if they have to see a specialist but don't have the income to pay for the copay for that specialist, or they don't have transportation to get certain procedures done because of difficulty, again, because of socioeconomic status, it can actually impact the type of data that we're getting from the patient that we're reporting to the insurer.
From a multicultural perspective, value-based care is different depending on the culture. But for Latinos, there's mixed families, there are people that are undocumented, there are people who talk Spanish, especially the elderly. There's a need for translation services. There's a need for respect of people coming from stressful neighborhoods, living in poverty with less education, humility, and just don't ask the questions that they should be asking out of respect for the providers.
I think physicians, what we really need to provide care under a value-based payment structure, especially for communities that I care for, that are immigrant, non-English speaking, we need a few things. One is we need very good systems that are provided by our bigger network of colleagues, as well as the systems that we should have in place with regards to providing the kind of care that's going to be quantified and part of the data structure. In addition, I think we really need a lot of coaching because most of our practices are relatively small. In fact, many of our practices rely just on family members or just from a few individuals that we've had in our community for several years. They're not necessarily very familiar with the systems that are needed to be in place in order to participate in a value-based structure. So in addition to those aspects, what we do need is the kind of support from not only healthcare delivery systems, but also from our patients themselves, because they need to understand what we are going through and what we want to do to provide the best care that we can provide to them.
When you're talking about the population that I'm representing, the African American community, you have to look at where we come from and what resources we have. So if we're going to improve population health for those patients in my community, you have to look at the system, you have to look at the support care that we have or that our patients have, the data collection system, as well as staff training, because again, it is critical that we train our staff and that they are culturally competent in providing those services. So again, our access to resources is not going to be as great as the majority population, and that must be taken into consideration. Time and resources are critical if we're going to improve and provide the same quality of health care for our African American population or other multicultural populations.
Well, to improve the population health of my community, the patients who I have influence over, it's usually education. It's time spent having them understand the importance of the various preventive care types of procedures and techniques and things that they need to do in order to improve their health and well-being. So it's always about education. It's always also about caring and having the kind of sense that the patient knows that you care. I heard once said, it was very nicely said, nobody cares about how much you know until they know how much you care. So that's what's important, is that you give that sense that they know that you care.
To improve population health of the Latino community, hospitals and health systems, medical practices need to take into consideration what we call the social determinants of health in that community. We know now that 80%, 90% of illness is really caused by these determinants that can be anything from economic and the social places we live, like our housing, our workplaces, our schools, as well as the environment, transportation, lack of transportation, having toxic stress due to gangs, crimes, lack of services, lack of parks for physical activity, lack of good food and vegetables and fruits that are called food deserts. So we have, a real need in our communities that has to be recognized in the decision-making by our health systems.
The social determinants of health are really important for all patients. Aspects of food security, income, shelter, these are things that I think the healthcare delivery system is recognizing among all our patients. But I think in the Asian American community, especially in communities that are largely immigrant, low income, they have additional burdens. Additional burdens with regards to health literacy, additional burdens with regards to understanding English, different expectations of what comes out of the healthcare delivery system. And for that reason, physicians that are practicing in these communities actually face additional risk under the value-based purchasing formulas. What we need to do is to find some ways in which we have the systems in place and the people in place to help us achieve this goal of having very comprehensive care that anticipates these social determinants of health among our very special group of patients.
Not only as physicians, but all of the team that takes into effect. We know that for African American patients, they get a lot of their services from the pharmacists. They talk to social workers and other care coordinators. So it is tremendous when we start to talk about social determinants of health, and it is high time that is recognized in terms of the value that we are providing for our patients, particularly as we talk about health outcomes. Very much important. And so when the government speaks on value-based care, it is the funding that is put into that, because again, we're taking care of the whole patient in the community that they come from, and it is important that we look at that if we're going to truly impact health outcome, and I should say if we are going to improve health outcome and keeping our vulnerable populations healthier.
Well, it's variable. I do have a mixed population, but I do notice that the patients who have the lower socioeconomic status, if you will, have more difficulty. As an example, I had an elderly woman come in the other day, and it's been difficult for her to come in because she doesn't have family members, she can't afford to get her transportation here. So she's been out of control with her blood pressure, out of control with her diabetes, that sort of thing. And it's a social determinant. It's determined by her socioeconomic status. She has a great difficulty right now with her mortgage, for example, so she has to prioritize whether she can pay for her mortgage versus whether she can pay for her medicine, whether she can pay for a lift to get here. So all of that impacts her health and her well-being, unfortunately.
The main impact of social determinants of health on our Latino community is poverty, which means neighborhoods have less access to food and nutrition, less access to parks for physical activity, housing that is overcrowded because of low incomes, families living together, to come up with rents or ownership. And we have housing that's dilapidated with lead poisoning and lack of air conditioning, just lack of comfort within the house. And then we have little transportation. If people don't own a car, they have to rely on public transportation. In our inner cities, it's overcrowded transportation, public transportation. And then we don't have access to services because there are very few doctors' offices, dental offices, pharmacies in our inner cities or our rural communities.
The opportunities we have under value-based care, particularly in the immigrant Asian communities, Pacific Islander and Native Hawaiian communities, are profound. I think what we have to do is to see that under value-based payment, we have the opportunity to highlight the special challenges and the special services that community-based providers provide in this community setting. We have the chance to really work with a team of health professionals to deliver an excellent care, because it's not going to be just physicians who are going to provide the kind of care for referrals, for mental health services, for coordination of care. It's going to involve a number of people on the healthcare team, non-physicians as well. And we're also going to need our patients to be able to vocalize and amplify what their particular needs are.
If we're going to have a successful value-based care, it requires collaboration of our specialists. But again, the opportunities are really important for us to work together. As the 118th president of the National Medical Association that is responsible for the minority providers that we care for and the patients that they see, we must consider and drive down the cost of care. But we have to take into consideration, we're talking about the whole patient and where they come from. So it is imperative that the government work with organizations to make this move in a way that is going to impact and improve the health outcome of our people, particularly access to care, quality of health care, and affordability.
Well, value-based care actually provides an opportunity to have your team of staff members, the providers, everyone focused on better preventive health care. We're actually being measured oftentimes by the quality of care that we're giving in that preventive area. So as a result, it's an opportunity to make sure that, for example, our patients' colonoscopies are being done, to make sure that their diabetes is well controlled, that their blood pressure is controlled. We're actually being paid based on how good the quality is. So it's an opportunity to increase the quality of care, and it takes a whole team effort to make sure that's occurring.
Opportunities for success in value-based care, well, that means that we really need to have more partnerships, public-private partnerships. We need Medicaid and Medicare and other public programs like SNAP, which is our food stamp program, our farmers markets from the Department of Agriculture, HHS cultural competence programs, just WIC, Women, Infant, and Children, school lunch programs. Those are all public programs that need to be partnered with our medical practices and our healthcare systems. We need to help encourage the education of our families who don't even know about these programs to apply, who may be fearful because somebody in their family is undocumented, but they need to apply for especially for kids that are in schools that are citizens who can be eligible for programs like school lunch programs. And I think that the importance of this cooperation and partnership goes beyond just public-private. Just in a community, doctors and dentists and pharmacists and nurses need to work more closely together, especially those who take care of Latino patients, to share in their programs, in community outreach and prevention, outside of the medical office or dental office and help get more people to learn about what healthy lifestyle is.
This video serves to educate some and remind others that this transformation journey is unique and requires a multidisciplinary and multicultural approach to design the future of our nation's healthcare system. A patient-centered approach must continue to be at the heart of our work. Finally, a special thanks to each of the clinicians for taking time out of their schedules to share their perspectives. Also, a special thanks to our Minority Medical Association partners for their contribution. And then finally, a special thank you for your time and commitment to improving the quality of health for all Americans. If you'd like more information about HCD International, check us out at hcdi.com.